Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. Mental health among adolescents is a huge concern even before the added stressors of the pandemic piled on. Today, Stephanie Desmond talks to Dr. Tamar Mendelsohn, director of the Johns Hopkins Center for Adolescent Health, about a program she is refining that brings mental health prevention services directly to teens where they are, in the schools. Let's listen.
Tamar Mendelsohn, thanks so much for joining me.
Hi, thanks for having me. It's a pleasure to be with you.
Thank you. I'm so glad you're here because I want to talk to you about something that's really important, and that is anxiety and depression among teenagers. I know a lot of people say that it can be blamed on the pandemic, but that's not what your research has shown.
No, in fact, we've seen increases in depression and anxiety among teens and children pretty much since 2011. There's been an increase. And I think it took the pandemic for people to really stop and appreciate that this really is a serious problem. Of course, during the pandemic, we also saw an additional bump up in these kinds of mental health issues.
Could you quantify for us a little bit this mental health issue among teens?
Yeah, absolutely. So about 1 in 6 young people in the United States, ages 6 to 17, experience a mental health disorder each year. And 50% of all lifetime mental illness actually begins by age 14, with 75% occurring by age 24. So actually, the adolescence is a time period when a lot of these mental health issues are emerging, and it's really important for us to be aware of that and to actually try to prevent mental health problems from happening in the first place.
So one solution that you've had is to bring mental health to the schools, to the kids where they are. Talk to me about that program.
Yeah, absolutely. So schools are a really promising context for addressing young people's mental health because we know that young people spend most of their time in schools. In addition, schools that are able to offer mental health supports and resources and programs, oftentimes it has a really positive impact on school climate more broadly and helping young people to be aware of how to manage emotions and stress. So our team has been adapting and testing a program called Rap Club for many years now. And this program is a combination of mindfulness skills, cognitive behavioral strategies, and education about the impact of stress and trauma on our bodies and brains.
And what does Rap Club stand for?
RAP Club stands for Relax, Aware, Personal Rating, and that's because that's one of the core skills. In every single session, young people spend a few minutes at the beginning being guided by the instructor in doing some simple breath work, checking in with themselves, and getting aware, noticing what is happening with their emotions, with their stress level, really teaching young people to do a check-in as a foundation before they do any other kind of skills.
So how did you do this program? You started with a small group of students in one school?
So originally, this Rap Club program was a treatment program rather than a prevention program. It was delivered in clinical settings for young people who had experienced trauma. We did some community-based participatory work with young people in Baltimore, and they helped identify this program as one that seemed like it would be a really good fit for young people in Baltimore. So the idea is that it's a program that is trauma-informed, and it's appropriate for young people who may be growing up in under-resourced communities where they're exposed to a lot of different kinds of stressors and adversities. So together with the young people, we adapted the program from its original form. It was called Sparks, and it was, as I said, a treatment program, into this prevention program called Rap Club. And we actually first began using it and testing it in the youth opportunity centers, which serve young people who left school and are looking to get job training or GED prep. So that was going well. And then we decided, well, why don't we adapt this further so we can offer it in schools to upper middle school students before young people have left school. Maybe this program can help young people to make a positive transition into high school and can really help them reach their potential.
And when you talk to the students, what were they telling you they were looking for?
Trauma was a big theme. A lot of young people talked about just the kind of things that they were witnessing in their communities, in their neighborhoods, seeing violence, knowing of other people who had been victims of violence, and just getting numb to it in a way. And either that or feeling really activated and having trouble sleeping and different kinds of symptoms that are often associated with trauma. This program, in its adapted form, it's really appropriate for a wide range of young people. So even if a young person has not experienced trauma, these are practical life skills that really can help you be more in touch with your emotions and figure out what are the most effective ways that I can make decisions right now. In addition to that, I think that they really are sensitive to trauma and give young people who have those exposures the kinds of supports that they need.
I know that mental health treatment can be stigmatized. I know this is a prevention. Is there a way that you've gotten around that?
So we really frame this as a class for managing stress. It's not a treatment program. It's not a therapy. And we envision this as being only one piece of the kind of supports that young people should have in schools. So this program we think of as universal prevention in the sense that it can be offered to all 8th graders in a school. They don't need to be screened for risk factors or symptoms. However, it's not a silver bullet that's going to solve everything. So there are still going to be young people who have needs that would require more specialized intervention. Having school psychologists, social workers, counselors, that's a really important piece too. The hope is that if you have these types of universal programs, that could help address needs for some of the students and promote good outcomes overall for students and reduce the number who actually need one-on-one therapy or other kinds of interventions. And the more we can do that, obviously, it's really helpful because it reduces the burden on mental health care providers.
So what have you learned from what you've studied so far, and where are we going with this?
Yeah, so we did start small with just a couple of schools, and we saw promising results in terms of how young people who were in the intervention in Rap Club, teachers were really reporting significantly greater academic performance, classroom behavior, and social and emotional growth for those young people compared to students who were not in the program. Based on those findings, we got funding from the NIH and the Institute of Education Sciences to do a larger efficacy trial. So that means we worked with 29 Baltimore City public schools. We recruited 615 8th graders, and we assigned them randomly either to get the Rap Club program or a health education program. And what we saw is that young people in the Rap Club program had significant improvements in depressive symptoms, anxiety symptoms, trauma symptoms, and behavior problems over the course of 1 year. And that was their transition into high school. So it suggested that these young people were actually having a more positive transition than the group who had the health education.
That's terrific. So how scalable is this? Can we see this in all the city schools someday?
I would love that. I think it is a scalable program, but that is one of the most challenging aspects of doing intervention work. I think we actually have quite a lot of different evidence-based programs that work well in studies. And then the real hurdle is how can we make those programs available to schools in a sustainable way so that they can really make use of them? One thing that we presented our findings to Baltimore City schools, and one thing they were particularly interested in is that The pandemic happened in the course, sort of the later end of our research. And so we were able to see how young people were doing during the pandemic. We recontacted them. And what we saw is that young people who were in the Rap Club program, and this was 1 to 4 years prior to the pandemic, compared to those who weren't, the Rap Club participants, it did not have increased anxiety during the pandemic, whereas the control participants did. So Rap Club actually had a protective effect during the pandemic. And I think schools were really pleased to hear that, because schools are really struggling to figure out how to best support students during and post-pandemic. So we've been presenting the findings and really working on that next piece of how do we transition this into a model that's going to be more sustainable for schools.
And now I'm going sort of pie in the sky. It feels to me like it doesn't even need to be city schools. I mean, not only disadvantaged populations, but perhaps other populations might benefit as well.
Yeah, so our team actually recently submitted a grant application to NIH to do just that. So what we would love to do is to continue working with Baltimore City Schools, which have been our partners for many years, but also expand to other districts in Maryland and really look at delivery of this program by school personnel rather than by study team members. One thing that we've done, this was really an idea of a young person way back when we first adapted the program, is to have young people co-facilitate the groups. So when we did the work in Baltimore City Schools, we had a member of our study team leading groups together with a young adult community member who was closer in age to students, had some more buy-in and trust with the students. And that seemed to really help the process. And so we would like to look at that as well and see how much difference does it make if we have a young person who's co-facilitating? How much difference does it make if the school person who's leading the group is actually a trained mental health counselor versus somebody who doesn't have specialized mental health training? So what we're really hoping in this next phase is to look at all those questions and try to figure out sort of what's the optimal way to deliver this program so that it has impact, but is also sustainable.
You must feel a sense of urgency.
I do. I mean, we hear from teachers and students just how difficult this period is, right? And we've talked already about how mental health was a concern even pre-pandemic, but I think schools are currently really struggling to regain their footing post-pandemic, or I guess we're not even really post, but I guess we're easing into post-pandemic. And there's a lot of issues right now. There's a lot of school burnout among teachers, turnover among staff. Many students are not attending school regularly. The attendance rates are lower. There's a lot of school refusal. And some of this is due to mental health issues. So I do think there's urgency to try to get schools equipped with strategies that can help empower students to just achieve their potential socially, emotionally, and academically.
Mar Mendelsohn, thanks so much for joining me.
Thanks for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.